Hello, anatomy friends. Let's talk the bones of the lower limb. And as we'll discuss, there are some very distinct similarities with the upper limb, but some very distinct dissimilarities. And this is all associated with the overall functions of the lower limb, which we will discuss. As you can see, we're going to talk about each of the bones of the lower limb, some in a bit more detail than others. And then there are certain structures, bony structures that I do want you to better understand as well. Okay, so we talked about the upper limb. The upper limb is important in terms of allowing mobility, the precision movements that you can have with the hand, whereas the lower limb is going to have two major functions. First and foremost, it's going to support the body weight. So really the femur and the tibia are really serving as almost pillars in order to allow us to be upright. The other major function of the lower limb is to allow for locomotion to occur. So not only locomotion, but specifically bipedal locomotion. And so there are some very distinct differences between the upper and the lower limbs and between the lower limbs of our species and others. Also, as you might imagine, the lower limb is going to play an important role in terms of maintaining balance as well. And we will talk, and I have 5 subdivisions here. Really, I should have 4. Can't even count, right? So we're going to have the 4 subdivisions that we will discuss in more detail. Specifically, we'll talk about them as the separate muscles. But you'll have the gluteal region, which is in the posterior hip region. You'll have the thigh. Sometimes you'll hear this referred to as the femoral region, the leg, or the crural region, and then, of course, the foot. All right. So let's start with the longest bone in the body. Some literature will say it makes up about 1/4 of an individual's height. So this is the longest and also the heaviest bone of the body. And it makes sense. It's going to be really taking on a lot of the weight from the body. And as you can see here, it is going to have an articulation up here with the coxal bone and then an articulation with the tibia. So let's start proximal and move our way distal like we like to do. And generally the most prominent thing that you can see associated with the proximal femur is the head. And the head is going to articulate with the acetabulum of the hip bone or the coxal bone. And so this is going to be the ball component of the ball and socket joint. And it'll always be facing medially. And that makes sense. It's always got to be facing towards the hip bone or the coxal bone. So when you're trying to get yourself organized in terms of what structures are what on the femur, head is always medial. Just distal to the head, you will see a pinching in of the bone before you get to the trochanteric portion. And this is referred to as the neck of the femur. The neck is actually a fairly clinically relevant region because you can have fractures. You can see that right here. Associated with this region with a little bit more frequency than in other areas. There's a bit more spongy bone here. Fractures to the neck of the femur are sometimes referred to as a fractured hip, which is a bit of a misnomer, but it is very closely associated with the hip joint. Okay, now let's move on to the trochanter region. A trochanter is basically just a large tubercle, so a mounding of bone because of muscle attachments. And you only have this term trochanter associated with the femur. So you only have a greater and a lesser trochanter only on this one bone. The greater trochanter is something that you can actually palpate on the side. You can often hear it referred to as the side of your hip. So it's basically opposite. So this is the hip joint here. It's basically opposite to that region. So that is the greater trochanter. And as the name would suggest, it is greater or larger than the lesser. So whereas the head is always medial, the greater trochanter is always lateral. And since it's so large, you would assume that there's going to be lots of muscles attaching here. And you do have many muscles attaching here. I've named 3 of the largest ones. There are even more. So you're going to have the gluteus medius and the minimus, not the gluteus maximus, even though it does kind of skirt right over this region. So it could affect the bursa associated with the greater trochanter, but really true attachment side is going to be the gluteus medius and minimus, as well as the piriformis muscle, and then some of those deeper muscles in the gluteal region. Now, the lesser trochanter is going to be smaller. You really only see this one from a posterior view. So there's that greater trochanter there. Lesser trochanter is going to be inferior or distal and only on the posterior surface. This is going to be attachment site of only one muscle, the iliopsoas, but this is an important muscle. This is going to be the major flexor of the hip joint. So we'll talk about this a bit more. So although only one muscle attaches here, it's an important one. Now, if you're looking at a posterior view of the shaft or the body of the femur, you'll see a fairly prominent line of bone. So kind of a long mounding of bone, referred to as the linea aspera. And this can be larger in individuals that have more robust adductor muscles or muscles of the medial thigh. These are going to attach along this line here. So something fairly prominent. As the name would suggest, these muscles are going to play a role in terms of adduction of the hip joint. As we move to the distal portion of the femur, you do have epicondyles, which you can see here. They're going to play a role in terms of ligament attachment, similar to what you had in the ligaments, as well as tendon attachment is what you had around the elbow joint region. But really, I'd rather you focus more on the condyles. And so notice on this particular image here of real bone, you can just see how bulbous and how large these condyles are. And this is going to be in direct comparison to the really shallow condyles of the tibia. So you have these fairly large condyles of the femur articulating with the condyles of the tibia. And so they kind of, these femoral condyles will kind of rock on the tibial condyles during flexion and extension of the knee joint. How to tell the difference between the medial and the lateral condyle? Well, I typically would not have an image like this for you. I would have an image where you can see the entirety of the femur. And remember, the head is always going to be medial. So I know this is medial, greater trochanter is always lateral. Therefore, that makes this the medial condyle of the femur and this the lateral condyle of the femur. So really getting to know the directionality of the structures that we're having you identify. Okay, moving on to the patella. If you were looking at an anterior view of the femur on the distal end, generally you would see that there is a bone right in front of it or kind of on top of it that articulates, and this is the patella. We colloquially refer to this as the kneecap. This is the largest sesamoid bone of the body. So remember, sesamoid bone means that it forms within a tendon, and specifically this patella forms within the quadriceps femoris tendon. And so on the posterior surface, you're going to have thick articular cartilage because it's articulating with the anterior surface of the femur here. And this really serves to kind of modify the direction of pull of the quadriceps tendon. It increases that leverage of the quadriceps tendon, and it can help in terms of improving the efficiency of the movements of the knee joint, more precisely in terms of extension of the knee. So an important little bone here, sitting right here on this distal surface of the femur. Okay, moving on to the second longest bone of the body. This is going to be the tibia. And sometimes we think of the tibia or hear the tibia referred to as the shin bone or the shin. That's because you can palpate a good amount of the tibia when you kind of run your hand down the anterior surface of your leg. The tibia is larger. It is going to be the medial bone of the leg. The fibula will be lateral. And I hope I don't hear you say tibula and fibia. No, let's get those names right. Those are the common mispronunciation. It is tibia. Okay, so this is the weight-bearing bone of the leg. The fibula does not bear weight. It is there for muscle attachment. It's going to help to provide some stability of the ankle. It is the tibia that is taking most of the weight from the femur down to the foot region. Now, we talked a little bit about these condyles in the last slide or the slide before that. So you're going to have a medial and a lateral condyle of the tibia, which is basically just this fairly shallow articular surface that allows for those fairly large femoral condyles to be able to rock during flexion and extension. So really shallow, again, not a particularly good fit between the bones of the knee joint. So you're going to have lots of other structures like ligaments and tendons to help increase the stability of the knee joint. Just distal to this region, this condyle region of the tibia, you're going to have a bump referred to as the tibial tuberosity. And you can actually palpate your own tibial tuberosity. So if you feel where your patella is, and then you move just kind of inferior to that, you should feel an anterior projection. And this is the tibial tuberosity. You see the term tuberosity here. So this is going to be the attachment for the quadriceps femoris tendon. Now, sometimes, so the quadriceps femoris tendon, again, is going to have that patella that's forming within there. So we'll call that the quadriceps tendon. Once you get past the patella down to the tibial tuberosity, that tendon's name changes. Often you'll hear it referred to as the patellar ligament, because from that point, it's going from the patella to the tibial tuberosity. So it is going from bone to bone. So even though it really is just a component of the tendon, the name does change, and you'll often hear it referred to as the patellar ligament. Now, moving down to the distalmost portion of the tibia, you will have an articular surface down here for the talus or the talus, which is one of your tarsal bones. And then you can prominently feel on the medial side of your ankle region this structure called the medial malleolus or the medial malleolus. You'll hear it both ways. So this will play a portion of that ankle joint region. All right, next you have the lateral fibula. Again, this is not a weight-bearing bone. It does not actually even articulate with the femur, but it will articulate with the talus, as well as many different joints associated with the tibia. So similar to what we had with the radius and the ulna, you'll have a proximal joint, you'll have the interosseous membrane, and you'll also have a distal joint between the two. This is going to be a bone that has considerable muscles attaching here. So a lot of the structure and the shape of the bone really has a lot to do with the muscle attachment sites. You are going to have a head, which is typically the widest region of the bone, but not particularly wide really in comparison to other bones. So here's your head. It will articulate with the tibia to form that proximal tibiofibular joint. And then one of the other most notable structures of the fibula will be the lateral malleolus or malleolus. This is you can feel this on the lateral side of your ankle joint. It's that bump there. And so you'll have the lateral and the medial malleolus, and then you'll have the talus or talus bone right here. Now you can have fractures to this general distal region. It's one of the more common regions where you'll have fractures. This is often referred to as a Pott's fracture, typically, or most typically when you have a transverse fracture of the distal fibula. It can extend to portions of the tibia as well, particularly that medial malleolus. But really it's the fibula that's going to be the most common. Okay, now we're moving into the ankle region as well as the foot. The tarsal bones are similar in number to the carpal bones. So there are 7 tarsal bones on each side, whereas there were 8 carpal bones. But there's some fairly big differences here. The tarsal bones are going to be quite a bit larger than what we had with the carpal bones. Some of these are very distinctly weight-bearing. And it's going to be a bit more associated, some of these tarsal bones will be a bit more associated with the foot than what we really had with the hand. Like carpal bones are truly in this wrist region, not so much in terms of what we think of as the hand, whereas that won't exactly be the case with these tarsal bones. Often you hear these referred to as the hind foot with the talus and the calcaneus, and then the midfoot would be these more distal carpal bones. There are 2 that I want you to be able to identify and understand some of their function. The first is the most superior one, and this is the talus or the talus. So you can see that one here in this image. This is sometimes colloquially referred to as the ankle bone. This is the tarsal bone that's articulating with the tibia and the fibula and helping to form that talocrural joint. The other tarsal bone that I want you to be able to identify is the calcaneus, aka the heel bone. And this is the one where if you kind of put your heel to the ground, obviously you're on skin and some of the connective tissue there, but you're also on that calcaneus. You'll also have the calcaneal tendon attaching here, which is more colloquially referred to as the Achilles tendon. So that would kind of come down and attach like right here. You do have obviously more tarsal bones. You have the navicular, the cuboid, some of the larger ones, and then you have the three cuneiforms. I just put these names here so you will have seen them. I won't ask you to be able to differentiate between them, but they are again larger than what we had with the carpal bones. And then we get to the forefoot, and these are going to be the metatarsals and the phalanges. You have the same numbers in terms of metatarsals as you had with metacarpals, and then you have the same number of phalanges. These are similarly shaped, but there are some distinct differences from the upper limb, but certainly these are a bit more similar than what we have between the carpals and the tarsals. Now, one of the big differences here is that, so while there are 5 metatarsals and they are numbered 1 to 5, recall that in the palm region, the metacarpals are 1 for the first digit, but that's going to be lateral, right? Whereas here, number 1 is associated with the great toe or the big toe, but this is going to be medial. So it goes from medial to lateral in the foot, whereas it goes from lateral to medial in the hand. Now, but the first digit's always associated with the largest of the digits. So, and this all has to do with rotation that occurred during embryonic development as to why the foot's more medial and the hand is going to be lateral in terms of its placement. So we go from 1 to 5, medial to lateral. You'll have the carpometatarsal joints and then the metatarsophalangeal joints here as well. And then you have the 14 phalanges. You'll have the same setup as what we had in the hand. So 5 proximal, 4 middle or intermediate. You're missing 1. Between the first digit here, same as what you had with the thumb, and then you have the 5 distal phalanges. The distal phalanges of 4 through 5 are extremely small and not very descriptive of this particular size. These you do have those proximal, so you have a proximal interphalangeal joint, so the PIP, and then you'll have your distal interphalangeal joint, similar to what you had in the hand. So I said similar to what you had in the hand quite a bit when we're talking about these structures here. All right, excellent. So we got through all the bones of the lower limb in one video. It was a bit easier because we'd introduced the bones of the upper limb where there are some distinct similarities. But again, overall size is going to be larger in the lower limb. They're going to be a bit more robust, and that has a lot to do with the weight-bearing component of the lower limb. All right, here is your question. When someone says they have fractured their heel bone, in quotes, you quickly recall that they are speaking about which tarsal bone. Are they talking about the calcaneus, the cuboid, the second cuneiform? People often talk about that. Okay, talus or talus, or the navicular. So pause the video if needed. And when you're ready, let's talk about how A is the correct answer. The calcaneus is going to be the inferior portion of the more posterior part of the foot. This is going to be associated with the heel region. You do have the calcaneal or Achilles tendon attaching in this region as well. The talus is kind of sitting on top of the calcaneus. This is more associated directly with the ankle joint. And then we didn't so much talk about these other, these are tarsal bones here, the cuboid, second cuneiform, and navicular, but these are not going to be what most people are thinking about when they think of the heel region. All right, excellent. Thank you so much for your time and attention here. We're going to move on to in the next video to start talking about the joints of the lower limb. See you there. Thanks.